Now Congress is tackling two big issues. First, you got the fallout from President Trump's firing of FBI Director James Comey. And of course, now the Senate is getting ready to take a crack at the House-approved Republican health care bill.
Well, we have Congressman Darrell Issa joining us live right now to talk about these things. Welcome.
Good to be back, and yeah, there's certainly two different issues, but they're both going to be big this coming week.
Yeah, let's talk about the Comey firing. What's your take on that whole situation and the calls for a special prosecutor?
Well, certainly, first of all, the independence of the investigation of, if you will, the activities of Russia are going on in the House and the Senate and in the Department of Justice, and they need to continue, and they need to be as transparent for oversight as possible, but not so public. You know, one of the problems with Director Comey is he became the story. He wanted to be in front of the mic. He did this in the Apple case, they essentially demanding that Apple de-encrypt their protection for your privacy. He did it again with Hillary Clinton, not once but twice, and he was seemingly doing it endlessly in this latest investigation. And that's unfortunate because the FBI is a great organization that historically does things quietly behind the scenes and turns it over to the Department of Justice for prosecution. And you need that. So I hope that as we select somebody to replace him, it's somebody who's equally qualified but less interested in being in front of the camera.
Let's talk about the health care now. The GOP health care bill passed the House a while back. Now, your office has been flooded with protesters.
Well, it's actually the same amount of protesters, they just added a subject.
That's correct. And are you hearing them, and what's your message to them?
Well, I've addressed them twice personally, gone out to the protesters, plus held a total of 6 town hall meetings have now been held, and I'll be holding another one. I'll be holding many more or less one a month of some sort. But, the message is, I hear you. We're trying to both fix the healthcare subsidy insurance program, which is really what Obamacare was, but we're also trying to get to the cost drivers of healthcare. There was almost $2 billion additional dollars for NIH for research into diseases, because at the end of the day, it's really not about insurance in America. It's about healthcare cost. It's about fighting diseases, but doing it in a way that doesn't cripple the family budget. And we have a long way to go, and we've got to resort out what is California's obligation, what is your personal obligation, and what is the federal role, and that's really what the dialogue between the House and the Senate is all about.
Very quickly, I'm sure you've been following the story of the little boy seriously hurt in a hit-and-run accident. Prosecutors say the driver had been deported at least 15 times. What do you want to say to people who are very upset about that?
Well, to the extent that we can lock him up for the maximum time allowed, that's probably the most important thing. From a federal standpoint, we're going to have to deal with mandatory minimums for people who are deported and come back and come back and come back, regardless of whether or not they're doing this kind of carnage. We have a problem in America, and that is that essentially, even when somebody is adjudicated through the whole process and deported, it means nothing. And this individual will probably be a poster child. For the family, the sad truth is we cannot lock this individual up long enough to give them justice.
Immigration, health care, and the FBI. We tackled 3 issues with you this morning. Thank you very much, Congressman Darrell Issa.
I was glad to be on.
All right.